Welcome back. Tonight, we are tracking the fallout over fraud allegations at child care centers in Minnesota and what it could mean for Georgia families and providers. The U.S. Department of Health and Human Services has frozen all federal child care payments to Minnesota following a viral video alleging widespread fraud. The agency says it is now rolling out new payment requirements nationwide. Our Liza Lucas is checking with Georgia officials and advocates about what this could mean here at home.
So there are a lot of unknowns. State officials tell me they are working to get clarity on what they are hearing from reports, and advocates say they also have questions. Here's Mindy Binderman with the Georgia Early Education Alliance for Ready Students.
I think a lot of it is figuring out what's happening in Minnesota. Certainly any kind of fraud, if that exists, is something that we would want to address in Minnesota. Feeling pretty confident about our centers and certainly our Department of Early Care and Learning here in Georgia. But also a lot of questions about what the implications are.
That includes what this means for Georgia's CAPS program, which is primarily what our state uses this federal child care funding to support. The CAPS program helps low-income families afford child care, and about 51,000 Georgia children currently benefit. Now, Binderman says she is confident in Georgia leaders and child care centers here in our state, but also stresses that it's critical that any new federal rules don't slow payments. We know from our own reporting that many centers operate on very thin margins, so even a short delay in reimbursement could have a ripple effect. Now, details are limited, but HHS tells me that states will now have to provide additional levels of verification and administrative data to receive more child care funds, while Minnesota must meet stricter requirements for those centers suspected of fraud, including providing attendance and licensing records. In the newsroom, I'm Liza Lucas, 11 Alive News.